Being a psychiatrist in the military was really a great honor. I did all my training, including internal medicine and psychiatry in the military. So I learned about TMS back in 2008 at Walter Reed. In essentially January of 2009, we had one of the first devices. True military psychiatry is about that combat stress control that you're doing in a combat environment. But the rest of the time, it's a lot like civilian psychiatry.
Being in the military has changed my perspective as a psychiatrist. I regard severe depression as a psychiatric emergency.
Depression is a real illness. All right, let's be absolutely clear. Depression is not a weakness. It is not some failure.
This is something that is happening in the brain, and in many cases, it's not going to get better without treatment.
Not treating your depression is not only painful, it not only results in life consequences, but it can lead to actual medical damage.
You'll see a different culture between men and women when it comes to depression. And men, we've been taught to suck it up, and men will struggle through depression for decades before they go get help.
There persists to some degree the social stigma of, suffering is just part of the condition and you've just got to toughen it up and move on. And we saw that in the military, you see that in the civilian world.
There are people who know that they are just not going to try psychotherapy. In those cases, I think certainly TMS can play a very important role.
With this treatment, TMS therapy, and especially at Greenbrook, men can actually have the opportunity to have this treatment by setting up the tailored schedule that meets their needs. It gives them an opportunity to really try something that hasn't been done before.
I really, really like that kind of more hands-on approach to mental health.
Psychotherapy can be uncomfortable for some men. TMS is a medical procedure, and it can essentially help men function at their optimal level by taking away the inhibitions of depression.